My name is Dr. Geoff Warburton. I'm going to talk to you in this video about how you, as a manager within the NHS, can support a member of staff who is grieving. First of all, you need to know there are no special skills needed for this task. You also need to know that there's no right way to support a bereaved person. But there are some wrong ways. I'll get on to them shortly. Let's start with busting a few myths about grief. What are the stages of grief? There is no fixed pattern to how grief unfolds. The common held concept that there are 5 or 7 stages of grief is fiction. The originator of the stage model, someone called Elizabeth Kubler-Ross, identified it for people who are dying, not people who are grieving. It's been adapted to fit grief without any significant evidence. It's not helpful for people grieving to apply it. In fact, you don't need to apply any model of stages. Each person's grief is as individual as their personalities. What if my staff are too emotional? Grief is painful. Having painful emotions that go on and on is not a sign that anything's wrong, even when grief is experienced as unbearable. The amount of pain experienced is relative to how significant the loss is, not how unstable the griever is. Having emotional pain, even excruciating emotional pain, does not stop people functioning. And trying to block emotional pain is more likely to inhibit functioning than help it. In fact, some people find that if they remain busy and functional, it helps them with their emotions. How can I help staff to get over grief? You can't, and you don't need to. People encourage others to get over grief to make themselves feel better, not the griever. Grief moves through us in its own way and its own pace. Feelings of grief may go on forever, and often do, but this is nothing to be concerned about. Grief is uncomfortable at times, but this does not mean there is something wrong or something to fix. In fact, grief never needs fixing. What practical things can I do? Well, it's NHS policy for managers to demonstrate compassionate leadership. One of your first tasks in this regard is to approve any compassionate leave that may be needed. You need to check out your local HR policies about this. Talk to your staff member about how much time they may need off, and identify before they take their leave the ways in which they would like to keep in touch with you. Ask the person who's grieving how much information about the grief can be shared with colleagues. And if a staff member doesn't want support, then you must respect that. And certainly do not suggest mental health support unless you identify signs of trauma. I'll get to that in a minute. What's my main task as a manager? Your staff need a safe environment that acknowledges their grief. That's it. As a leader, it's your job to create that safe environment. So here's some tips on how you might do that. Make space and time to listen. It can be easy with a pressured environment to think there's no time for this, but usually the rewards of uninterrupted listening to your staff is more productivity from them, not less. Ask your staff about their grief. Here's an opener. I'm sorry about your grief. Do you want to tell me about it? Do this in a private one-to-one setting. Do not ask about their loss in passing, nor within a team meeting. Educate yourself to any spiritual or religious ways that they may use in their grief. There is already an NHS booklet about this available online. What's the wrong way? I mentioned earlier, there's no right way to support someone grieving, but there are wrong ways. Here are some of them. Do not pathologize grief. Do not avoid talking about grief. Do not suggest any ways to get over grief. Do not encourage strength and resilience. Do not try and cheer someone up. And never say, they had a good life. Let your staff be in pain. If you want them to feel better, that's your problem, not theirs. Also, do not become a counsellor to your staff. You want to be compassionate and acknowledge their feelings, but remember you're not a counsellor, even if you have counselling skills. Counselling is a mutually agreed relationship with the aim of psychological healing. That is not your task. If you go down that path, it'll make it much harder for you to supervise their work, especially if you have to challenge them later. If they need counselling, point them in the right direction. Be compassionate, but do not engage in any healing relationship. What about my feelings? One of the challenges you'll face in supporting your staff is how you feel about grief. Being in the presence of someone grieving will definitely stir up feelings in you. Your job is to deal with these feelings. This may mean getting support from a colleague or a professional therapist. Good leadership means getting the right support for yourself. When grief is traumatic. Trauma is when we experience something that overwhelms our capacity to deal with it. It affects our capacity to function in the workplace, and we usually need help to get through this. This is where a referral to a therapist may be needed. Signs that someone is traumatized can include panic attacks, anxiety attacks, trouble sleeping, intrusive thoughts, flashbacks, frenetic behavior, difficulty concentrating, angry outbursts, withdrawing from contact with others, amongst other things. Though some of these symptoms can overlap with regular grief, but if several of these symptoms occur, it's likely that the person will benefit from psychological input. This is where you'll need to muster as much sensitivity as you can. Nobody wants to be told they need therapy. So here are your takeaways from this video. It's your job as a leader to create a compassionate environment where staff feel safe to grieve. Do not attempt to advise, fix, or save someone from grief. If you try and help someone feel better, it will backfire.